Hello, everyone. I'm your host, Dr. Ramya Jariwala. I'm a pediatrician from Portland, Oregon, and I'm so pleased to welcome you, our lovely viewers, as we delve into the journey of wholesome well-being in our exclusive Manna TV international show called Health and Healing. In this show, we will discuss the tools and vital information to achieve optimum health. We will discuss those rudiments of health and well-being, which we all tend to miss, even though they're right under our noses. We are joined today by a very special speaker, Dr. Saraswathi Kalvakota. She is an internist and pediatrician at Kettering Medical Center, affiliated with Wright State University Boonshoft School of Medicine in Dayton, Ohio. She comes with over 25 years of clinical and teaching experience. Dr. Kalvakota's fund of knowledge and breadth of experience will provide the essential information we need. I am certain her talks in our Health and Healing show will be educational and helpful to apply to our day-to-day lives. So without further ado, we'd like to extend our warmest welcome to Dr. Kalvakota. It is so wonderful being here with you today, Dr. Kalvakota. We have a very exciting hot topic that Dr. Kalvakota will illuminate for us. Now, we have all heard a great deal of information about SARS-CoV-2 infection, better known as COVID-19. Today, we will deep dive into the realm of post-COVID syndrome. So let me start with a three-pronged question. Dr. Kalvakota, what is post-COVID syndrome? Are there any other names for this condition? And how is it classified under the American Disabilities Act?
Hello all. Thank you for such a great introduction, Dr. Ramya. I'm indeed honored and I'm proud to be here on Manna TV International for another series on health and healing. Today's topic is a burning topic now, which was not before. And Dr. Ramya's description is so complete about the topic for today. I will dive into this topic quickly so we can provide you a lot more information about this frustrating disease, which is called post-COVID syndrome. So this post-COVID syndrome, how do we know about this? What is this about? What does this mean at this point? Originally, we really did not know this entity is coming on to us because we never had COVID in the past. So COVID-19, which came as a tsunami and hit every organ in our body, and it has left with some of the residuals of the chronic symptoms. So now we are beginning to see more and more of COVID symptoms which are lingering on in our body and causing a silent epidemic. So COVID-19 was a real epidemic, a pandemic, and it created a lot of tsunami-like tornado, or the symptoms which are kind of came on like a powerful, forceful on human beings and hit everybody. Whereas this chronic syndrome is now surfacing up with the silent problems. So let us say, when do we call it this as post-COVID? Many times post this COVID-19, it's an acute episode of COVID-19, usually goes away by 3 months, and 95% of them get better without any residual problems. They are happy, everything is resolved, they get back to their life and then go back to their job and all that. And some people tend to have these lingering problems. So this is post-COVID-19. So this is also called long haulers, post-acute syndrome, COVID-19 syndrome. And these are such names attached to this entity, but they all means same. So actually, they are all synonymous. So when whoever came up with some symptoms, and then they found out these particular entities related to COVID, it came out as a different name. But again, they're all same. So what happens about people who really have these symptoms after a year and they cannot return to school or to a workplace, and they are so tired, they become disabled, they cannot function. So in the United States, there is an act called American Disability Act. So this is for protection for people who are chronically disabled. It is there for a long time. So the post-COVID patients who become totally disabled, this act comes into the picture. It protects them. And for that, there are a lot of documentations needed that this patient has really a dysfunctional quality of life. So those patients get some financial support. So at least they get some way to live their life and support their family. And that is an act which has been there for a long time. And this COVID-19, I'm glad to see some of them qualify, and then they get some support so that they will not suffer rest of their lives. So that's about the American Disability Act. So I know another question coming up, Dr. Ramya. So let's get into that.
Thank you, Dr. Kalvakota. That was very illuminating. Now that we know what post-COVID syndrome is and how it's defined, could you please explain to us what causes post-COVID syndrome?
Looking at the reason for this entity, COVID long-term entity, we have to understand a little bit what happened during the acute phase of COVID-19. It's kind of transition of a milder transition of what happened during the COVID-19. So during the acute phase, it's like let me give you an example. Like, you are going at a high speed in a vehicle, and then you get into accident, and whatever is surrounding that area, they get damaged, right? So the car gets damaged. At the same time, there is more damage is also taking place in the surroundings. Think of car as the COVID-19 virus. So now what happens, everything around, think that these are our body parts. So when it hits these organs in our body, several organs get damaged, and however, some of them do not get healed completely. And this is because in our body, there are chemicals, they are called cytokines chemicals, are released from our defense mechanism of the defense cells. And that sometimes may not get healed, may not fight completely. So why it doesn't happen? Let me give you a few cases why it doesn't happen. Because we know these people can have a higher morbidity, a higher chance of prolonging their disease entity. So these are people who have immunological compromise, means their defense mechanism is slightly impaired compared to normal adults. So who are they? So first, we all know diabetes mellitus. Next, hypertension patients. Third, people who are obese, people who have sleep apnea problems, people who have asthma, chronic bad asthma, or emphysema, and the people who smoke and damage their lungs over a period of time, they suffer to a certain extent to fight the disease. So these kind of people are at a higher risk to get problems more related to post-COVID syndrome. So these are something we need to keep in mind, because when we have friends or family with these problems, we need to be aware that these people can have a higher problems and problems which may not resolve or take longer time. So we can sort of educate ourselves and then attack the problems as they come.
Wow. Wow. Thank you, Dr. Kalvakota. I really liked your car analogy. That does paint the picture of what's happening inside our systems in a much more relatable way, I think. So now that we know what's going on in the body, could you please explain what are those lingering symptoms or side effects of COVID infection that fall under the spectrum of post-COVID syndrome? And along the same lines, could you explain what symptoms people should be aware of and how this awareness could help us?
Okay, this is very relevant to our audience. And if we can take some of this information or these points with you, you will be doing a great favor to yourself as well as to your family and others. So the question on here, how do we see things coming up are related to COVID-19 symptoms? It's a very good question. And it can be confusing too, because there are these symptoms, some of them look like, oh, it could be coming from some other problem. It may not be anything to do with COVID-19 long haul syndrome. But it's not, that is where the medical discretion as well as patients coming in the very early stage can be very helpful. Remember 3 major problems our long haulers suffer badly. One is the chronic fatigue syndrome. They're always tired to the point they cannot even get up and brush their teeth, or they cannot even do things, minimal chores at home, and then they end up not getting better at all, and they lose their jobs and things like that. So the chronic fatigue is a very frustrating and a relentless symptom they experience. We'll talk about it more later on. So I am here right now to enumerate the symptoms which are very common, and also some of them are not very common, but I think it is good for all of you to know. So what is the second one is the shortness of breath. They feel that very commonly with the COVID-19 acute episode, because it affects the lungs. And then many times it goes away, 95% goes away. But for these people, the effect of the lung symptoms linger, like shortness of breath, chest tightness. So this is another signal that the COVID-19 is lingering in this particular individual. So let's look at the third symptom, which is also not uncommon. They have a brain fog. We call it as a cognition, ability to make decisions. Somehow they come to quick confusion states, and they have always brain fog, like always not clear. And this is another vague symptoms these long COVID haulers suffer for a while. So remember, these 3 things are not fake symptoms, especially those who are weak. That people tend to think that he's becoming lazy, but as a matter of fact, this is the effect of acute COVID. Now, looking at the other symptoms in a systematic way, what are the other symptoms with the neurological effect? They can have seizures, they can have needles all over the body. It's like what we call neuropathy that goes also takes a long time to go away. And then, as I mentioned, breathing problems are another pulmonary problems. They linger on. And then it can also affect, unfortunately, heart too. And that relates to chest pain. That relates to irregular heartbeats. That relates to infection of the myocardial tissue, which is called myocarditis, pericarditis, and existing heart conditions can exacerbate with the COVID-19. So there's another thing to remember, that these people who are affected, who already have a heart disease, underlying heart disease, they have a problem to fight with the COVID-19 because heart is already compromised, and they get into, it puts a lot of impact on the heart to function and to fight with this COVID-19 long haul. And other symptoms related to GI, I mean gastrointestinal, they can have GERD, they can have what we call acute gastritis, they can have diarrhea, chronic diarrhea, so on, and symptoms like that. And they also noticed they tend to get hair loss. That is another things which can happen during this period. And a couple of things, again, they're not last, they're last but not least. They're important. People tend to lose taste and smell. And maybe I should have brought that in the beginning itself, but this is the most common symptoms they tend to have. And then most of them, 98% or 97% of them get better after some time. But some of them it can last for a while. So another thing is related to mental health problems. Because of their job loss, because of their long illnesses, they go into anxiety, depression, and they are isolated. They become lonely, and it is a stressful situation for them to endure this period. And because we don't have any miraculous drug to make them overnight better and get back to normal life, so that also has an impact on their functionality of the life. And there is another entity we call people who will stay in the ICU. There is a term called post-ICU psychosis. And these people end up in ICU, some of them sick people who are in ICU during the acute phase, they go through this psychosis phase too. And these are all symptoms. These are very disabling symptoms, and they linger for a long time. So I enumerated every organ-related symptoms because it does not leave any particular organ. It affects just like every organ we have in our body. And that's what I want you to be aware of. And I also want you to be aware of how important symptoms you should be looking for, be very much alarmed about it. So that.
Thank you, Dr. Kalvakota. I am very surprised, as I think a lot of our viewers would be, to hear how wide-ranging and multifaceted the symptoms or the effects of lingering COVID infection can be, and literally going from head to toe as far as the effects and the damages. So let's take these symptoms one by one, as I think we would all love to know kind of how to tackle these stepwise. So starting with the chronic fatigue part. Do you know, are there any ways to treat the chronic fatigue, Dr. Kalvakota?
These are things which are now again relevant to our audience. And the reason is these symptoms, which I'm going to give some hope or some management skills, because these are very frustrating. And I don't want you all feel that there is no cure to that. And I want you to fight and empower yourself to get over these problems. And it can be done. It is just telling yourself that you can do it. And eventually the symptoms will start getting better. Okay, what is that we face most common is chronic fatigue. And as I enumerated in the last question, chronic fatigue is the just not being able to do anything, and then extreme weakness, and then joint pains, and all those things make you that you are useless and you can't get better anymore, and I'm totally disabled. Those chronic disability which last after 1 month are very few percentage. So even chronic fatigue hits you, you should not be giving up the taking care of yourself, certain things. Okay, I'm going to give you a mnemonic which has 4 P's. So what are those? Pacing, priority, and the priority and prioritizing and posturing. So pacing, priority, posturing, and sometimes your own limits, and planning, and plan your day. That is another important aspect. So plan your day. How do you plan your day when you have so much weakness going on? You will find certain time of the day that you have little bit energy, and it's not, you will become aware of it when you start feeling yourself. So pick that time. Maybe you are kind of little bit better 4 p.m. or maybe you are a little bit better when you wake up. So select that time and then force yourself to get up and walk. And that is pacing at your own speed. Even it is 10 steps in 10 minutes, fine, you start doing that. And then that particular time has to be prioritized. You have to do this every day at the same time. So as you do that, your 10 steps taking 10 minutes are going to gradually decrease the time period you will be achieving those 10 steps. So that's wonderful. And that means your good hormones, as you are increasing your spacing, are going to kick in your body and then make you feel a little bit better. So that's one way to beat the stress-related, these chronic fatigue symptoms. So the last P relates to posturing. So you make sure that you don't unnecessarily, go into a situation where you have to bend too quickly, or when you have to turn too quickly, or you have to lift something heavier. Avoid any of those jerky or sudden movements and some things which are unexpected for you to do. So try to avoid all those things. The last one, when these things you are practicing on a daily basis, we can help you give some medications, like pain medications. It also relates to anxiety and depression. So there are several available and we can try. They are not habit forming. So they are not drugs, you should be worried about taking them forever. It is just to give you some physical boost so that it promotes or complements your daily activity. So that's how you beat chronic fatigue. And it is found to be very effective. Combination of these two are very effective. So next question on how you address these heart problems and the lung problems. And these are something you really have to have a specialist on board along with the primary care physician, because they can get more complex and they need to have a baseline education, baseline diagnosis of what you stand in that particular entity, cardiac or pulmonary. And it is best to see if the symptoms are getting better, or if the symptoms are continuing, or if they have to add any medications. So the cardiologist and pulmonologist will be very helpful to make you lift the problems and make you progress even quicker. So those are the two other problems. And then comes to another big entity with the COVID-19 patients during the acute episode and also during the long COVID time too, because the virus affects the blood circulation, the clotting mechanism gets affected. And there are some of the factors which make our blood flow fluently from one head to toe. So there is no blockage. There should not be any blockage when the blood is going to every organ. But somehow these patients tend to have clotting very quickly. And then when there is a clot, it is called thrombus, and then it can block the circulation. And that leads into serious illnesses called pulmonary embolism, deep vein thrombosis of the legs. So these are all connected, and we recommend some of these anticoagulant, and that has to be also done by the pulmonologist. So this is one of the dangers in the acute phase. And also we have seen quite a big number in this phase too. So if you feel your legs are aching, your calf muscles are aching, if you feel suddenly you are out of breath, all of a sudden out of breath, and that is a little alarming sign, and you should not neglect that. Calf muscle, leg weakness, calf muscle weakness, especially one leg is hurting your calf muscle. And that's also a very alarming sign, and you should not neglect that. So we covered this heart-related and neurological, and then we covered fatigue-related. And there is, this is a complex problem, and patients end up going to different doctors. And that can be very taxing. I understand that. For that reason, in this country, they are developing post-COVID clinics, and there are centers, they are already established in this country. And if they are there in your place where you are living, and you can really enter and enroll in those centers, and they will help you as much as possible to keep you in that center unless there is an issue which they cannot treat, and they will send you to the super specialists. And also in UK and other centers, other countries, also they are doing the same thing, post-COVID clinics. And they are very helpful. Number one, the records are kept in one place, and it's easy for CDC to pick up. And of course, every patient with the long COVID is, the records are sent to CDC, whether it is a small place, a big place in this country, the records are available. This makes it a little bit easier because they're all in one place. And I encourage that you seek those centers, clinics, help. So it makes it, even if it helps you 50%, it is definitely useful to you. So I think we have addressed all those symptoms. And in conclusion, what we have is many patients do get better. That's a positive sign we need to really remember constantly. And several conservative and medical therapies are available to complement each other so that your recovery becomes as smooth as possible. And then third thing I want you to really take home the message is, those who are not vaccinated for COVID-19, please go and get vaccinated. Because if the vaccination, the COVID incidence goes down and there is no COVID, no COVID-19. So you tackled and step before it even comes to. So COVID-19 is not there. COVID-19 long haul is not there either. So you have to look at that. So that is the positive thing. And all that we can recommend is please vaccinate yourself. And so that now it is, acute COVID is almost gone. But we still see here and there, but that's the milder part. But this vaccination, if it is given, it will also help COVID. It will also help Omicron. It will also help COVID-19 SARS-2 virus too. So this is take home or preventive things which you can do to yourself and empower yourself to take the disease in your hand and take care of yourself. Dr. Ramya, go ahead.
Yes, I'm really, really happy to hear that there are things we can do as the patients or as the victims of post-COVID syndrome ourselves. And you know how we in the world of healthcare really love our mnemonics or memory aids. So yeah. I really like hearing that there is a mnemonic to help us remember how to move and keep ourselves active. The 4 Ps, which if I heard you correctly, Dr. Kalvakota, planning, prioritizing, pacing, and posturing. So really good information for us to enable ourselves in the best position possible. So, that list of symptoms that is quite wide and comprehensive as part of post-COVID syndrome. Let's move on to the cardiovascular and pulmonary symptoms or heart and lung-based effects. How can we?
Okay, Dr. Ramya, these are questions I have already addressed a little bit in my previous, in your previous question. However, I can make it a little bit more, bring more information on this. As I said, this cardiac and these pulmonary symptoms are very nagging. And one symptom, which is very common for these long haulers, is the cough. This cough is so persisting, and it is so much different from the cough from cold or bronchitis and other things. And as we mentioned right in the beginning, the symptoms of chronic COVID is not related to infection at all. It is related to the chemicals, the cytokines, releasing all sort of toxic chemicals and causing the problems for a while. So what does this mean? It is a chronic inflammation in the lung tissue, which has a problem exchanging oxygen and carbon dioxide in our body. And this persistent cough is not really related to that problem. It is related to the problem right in the throat, in the vocal cords. What happens is any little change in the weather, like cold or this, or if you smell something, or if something raw materials, raw food you eat, it irritates your throat very quickly. And I mean to say that is hypersensitive to anything different introduced into the throat. So this is a very nagging, hypersensitive cough, and it is not related to infection. That needs to be really addressed, and we do not have any big medical treatments. Again, we start with minimizing the effects by being very careful, knowing what things are, kind of stimulating that vocal cords, number one. Number two is taking antitussives, means something for the cough that can help. It soothes your mucosa of the vocal cord. And then also you taking sometimes, steroid inhalers that can be useful. And these are the techniques which are given. And in the extreme cases, they inject steroid into the vocal cord so that symptoms become minimized. So this is a very nagging cough and frustrating cough, and it can go on for a while. And you just have to endure it and do as much conservative things as you can, and let it just fade off on its own. And many times, again, as with any other symptoms, this symptom also will resolve over a period of time. So that's about taking care of some important symptom of pulmonary. And of course, I already mentioned about cardiac problems, and never neglect any of that cardiac problems. But because that can lead to a fatal outcomes. So you don't want to do that. And another thing is when you become so deconditioned because you are in bed and you are not using anything, you just have to stop your physical therapy. You can go to centers where there is a physical therapy available. They help you get activities slowly at a pace where you are able to increase your strength. So physical therapy is also very helpful for people who have this chronic fatigue and musculoskeletal problems, joint problems, and that is found to be very helpful too. And physical therapy centers are everywhere in the country or anywhere in the world too, where you find you have this problem. Therapists can really work with you at your own pace and at your own energy level. So I hope I answered all your questions, Dr. Ramya. Anything else? Next. Stating call, Ramya.
Wow. Yeah. Anybody who has suffered with a cough for longer than a few days can certainly relate to what you're describing right now. And it is so good to hear that there are options and opportunities to help with those struggling. And the best news of all that you mentioned, Dr. Kalvakota, is that by and large, the cough recovers, or patients do recover well and fully from it over time. So let's go into one more symptom that you did touch on earlier, but given that it is such a characteristic feature going along with COVID, the anosmia, or the loss of smell and taste. Any treatments or recommendations to help with this symptom?
So my friends, we have really skipped one important age group. And this age group are children, infants, and teenagers. And I would like to just bring a couple of sentences on what's happening to them and how they are different from COVID, getting this topic on the disease, which is COVID-19 long haul. Fortunately, we have to thank that this group of children are not affected that much. Although we have incidents where some kids had to be hospitalized, and then we do not have enough statistics to say about the outcomes because there are such a small number. So that's the good news. Then another good news is that they have now, CDC has approved vaccinations for infants to 16, 18 years old. And that's another big thing came up recently. So that helped a lot. Helped prevent the Omicron too. So having said that, the pediatric group, this definitely a piece of information, you will feel relieved. At the same time, this is where you have to put your more attention taking care of yourself and your family members. So that's about the children. And in conclusion, I want you to take home 3-4 facts or points. Number one, COVID-19 long haul is definitely a small number, and most of them, they get better. Means what? All the symptoms I described, most of them get better. So do not be discouraged on that issue. Number two, bring awareness to the symptoms of a common 3-4 symptoms which people present during this phase, and remember to do something in a much quicker way, earlier way, so that you can get help as quickly as possible. 3, if you have not received any vaccinations for COVID-19, please do so, because anything can run a course of long COVID. Anybody, although it's rare or although it is not uncommon, you still don't want to succumb to that 1% or 2%. So with that, today's session, I'm confident that you are taking home messages which will empower you and take a grip of the situation of the long haul disease, so you can help yourself and your family and others. And thank you. And we will see you next session. And any more questions?
Yes, in fact, I have a final question. But before I ask you my parting question, I do want to thank you for all of that wonderful information and the really powerful take-home messages. I think it's really it's empowering to us when we know that there's things we can do on our own to help in our own recoveries. The herbal treatments you mentioned for the anosmia or the loss of smell and taste, lemons, clove, eucalyptus, and I remember you had told me about this sometime before, so I've been sipping on my rose.
Yes.
So that would be the
rose, right? Absolutely.
Yes, and all the other tips and tools that you armed us with, including that mnemonic for chronic fatigue, the 4 Ps, and just the knowledge of when to seek help, going to our primary care physicians, and the existence of these post-COVID centers, knowing about that, and effective care provided at those, all very, very important and really helpful tools that you have provided us. So thank you for that. And I would love to ask my final question, and this one is close to heart as a pediatrician. I work with the younger population in my own practice. And so my question, Dr. Kalvakota, is do you ever see differences with the children and teenagers as far as post-COVID or long haulers syndrome is concerned?
Yes, that's definitely a question which deserves attention here. These teenagers and the children and infants, the incidence of COVID seem to be very much less. And we really do not know enough of why these children get and are escaping from that to a certain extent. However, the new Delta wave which came recently has proved to be wrong. The other countries, we see children also being affected, including 1-year-olds too. So that's number one. Number two, even when they get the disease, the studies do show that the recovery period is very short and they can bounce back very quickly. So that's number two. Number three, patients who have had vaccinations, also they tend to have no disease, and then when there is no disease, there is no post-COVID. So that's another third factor to remember. So these 3 things are important in teenagers, and good news is so far these kids, most of them, they do recover, and we really do not have big statistics or research to see how many kids are really in these serious stages where they now are experiencing post-COVID syndromes. So, we still have a long way to go. And this new entity of post-COVID syndrome came as we are seeing patients after they recover from the acute disease. And we still are learning every day, and a lot of articles and a lot of research is going on to find out when and where it is going to end. Then we can say post-COVID is stopped. So we still want to hear that happening very quickly in the near future. I hope and answered the question on your kids.
You answered beautifully, and thank you. With your not only adult medicine but pediatric medicine background, I really appreciate that insight. And I just have to say, I'm so happy to hear you mention the vaccine component. I hope we can tap into your knowledge in the future, Dr. Kalvakota, in a future show episode and talk further on vaccines, which is a large topic in and of itself.
Thank you. Thank you, Ramya. And this is a beautiful topic, and I hope you have enough material to understand this and then take home and apply in your day-to-day life. And I want to thank Mana TV International for bringing this beautiful health and healing topics. And this is the first topic, which is on this COVID you have heard, and we have many more to come in the near future. So stay tuned and take home a lot of healthy and healing information for yourself. And thank you, Ramya, for all the questions you asked me.
Thank you, Dr. Kalvakota. So, dear friends, now that we are at the end of our show and we have learned some wonderful insights from Dr. Kalvakota about post-COVID syndrome or long haulers, as well as how to best protect ourselves and empower ourselves, we will be back again with another critical topic to champion ourselves with the best of health and healing. See you soon, and don't forget to like our Facebook page, Mana TV, and subscribe to our YouTube channel scrolling on the screen. Keep watching Mana TV International. Stay safe, stay healthy, and stay blessed.
Thank you all.